let's get into some causes so people understand the vast amount of diagnoses that, could be an answer to their pelvic pain, right?
Okay.
Usually people only know about maybe vaginismus causing vaginal pain. So there's a lot more than that we'll get into. Well over 20 diagnoses relate to pelvic pain,
Wow.
but we're not going to cover all of the potential. We're just going to,
Be here all
that
night.
we would
Yeah.
take all night.
They're
But
all
we'll get into
valid. They're
some,
all valid, but
all
we're
that. Yes, absolutely. But we'll get into some general reasons why you might be experiencing pelvic pain, and maybe a few diagnoses that go along with that. So you can start to look into these areas to see if this might be why you're experiencing pelvic pain.
okay.
Okay. So let's start with number one, which is hormones. This is a pretty common one with pelvic pain because there's a lot of things that can impact hormones. If you have a reduction of estrogen or testosterone or your hormone receptors, if there's an issue with those, there's an absence, you can be experiencing pelvic pain, probably in relation to a lack of lubrication. And some things that can affect your hormones could include your birth control, acne medications, infertility medications, giving birth. After birth, you have an estrogen dump. So giving birth, that's really common. About 50% of women in the first 3 months report pain.
Wow.
And again, that's just reporting, right?
Yeah.
We talked about shame, so not everyone might even be reporting that, but that's a big one. And then also like antidepressants, because those can affect lubrication, and treatments for different types of cancers. So there's a lot that could affect hormones that might be causing your pelvic pain.
And the change in hormones affects the level of lubrication that you're able to produce. So would the pain be related to too much friction happening and not?
Yeah.
Okay. Yeah. What about we're going to talk about the lining of the tissue, right? Because can hormones affect how thick or thin the lining is?
Yes. Yep. With hormones, you can have thinning of tissues, which can cause pain as well.
Which sounds like a tricky combination, right? Less lubrication, thinning of the tissue. That does sound painful.
Exactly. And along with that, another issue that could be happening is atrophy, like your thinning, and then that can happen because of endometriosis as well. You can have issues with tissues where tissue similar to the lining of the uterus is growing outside of the uterus as well. So there's lots of tissue issues, which can be hard to say, along with hormones.
Yeah.
And honestly, endometriosis is extremely painful. So we're not laughing at that. We're laughing at
tissue issues.
Just silly. Yeah. Exactly.
Yeah.
Exactly. So next big cause that we'll get into, which we already touched on just a tiny bit, which is another big one that might be more well known, is some pelvic floor issues. So there's two things that could happen with your pelvic floor. They could either be the muscles, they could either be too tight, which would be hypertonic, or they could be too loose, hypotonic. And if they're too tight, that means they're in a constant contraction, and it can feel really painful to have things
touch something that's a very tight muscle, right? It's like you had a really tight muscle in another area of your body, or like a knot or something, and sometimes pushing on that can really hurt, right?
Right, exactly. So something in relation to that we touched upon is vaginismus. And vaginismus is when your pelvic floor, those muscles, spontaneously or involuntarily contract. And this can feel like you're like hitting a wall. This can feel like a burning sensation. This can happen, even with inserting a tampon or a finger. It doesn't have to be for full penetration. And so this might be where things come about, where people are saying it's all in your head, because this can be seen as a fear response. Like your body is fearful, your mind is fearful of that penetration, and so your muscles are just clenching as in protection, essentially.
Right, which makes sense. Our bodies do all kinds of wild and miraculous things in an effort to protect us, right?
Right, exactly. And then in the long run, actually might be harming us in some sort of way, right? Like
Right.
causing pain.
Right. Well, it means well.
It
Like
means so well.
it does. It means well. We talk about this all the time in therapy with clients. Like our brains, tell us all kinds of interesting thoughts, beliefs, even bodily responses
Yeah.
related to trauma in an effort to protect us. But it ends up backfiring sometimes, right? Like
Yeah.
there's a downside to that reaction. So this would be a very obvious example of that.
Right, right, exactly. So with vaginismus, sometimes it is in relation to like anxiety or trauma.
Okay.
If you are someone who has experienced sexual trauma, I think it's really important that the first kind of work you do here, which is usually validated by OBGYNs as well, is trauma work. So you could go see a therapist certified in EMDR, which is a prominent trauma treatment right now, eye movement, desensitization, and reprocessing to work through that trauma and know you're not alone. About 1 in 5 women have experienced sexual violence. So
yeah, which is just so sad and horrific of a number.
Right.
But we can, through that style of therapy, kind of retrain our brain to have less of such an extreme anxious response, right? And kind of calm that reaction so that perhaps that guarding response, that fearful response your body's having is reduced.
Right. You're working through and processing that trauma first. And then you might work with like a pelvic floor specialist or a physical therapist to help you work also with your body in the muscular contraction as well.
Okay.
Even if you don't have vaginismus fully and you just have too tight of pelvic floor muscles, you'll want to see a pelvic floor physical therapist as well. Yeah.
Okay.
So that's pelvic floor muscles. That's a big one. I think that's a common one that comes along with that myth that is all in your head because of the anxiety, right? Not true, because your body is actually having that response as well.
Right. Well, that mind-body connection. It's
right. Exactly. Another thing that could be causing pelvic pain is inflammation. So inflammation can cause lesions on your skin, or you could be experiencing pelvic inflammatory disease. These things cause pain. Pelvic inflammatory disease can be caused by STIs too, like chlamydia or gonorrhea. So if you are experiencing one of those, that could be leading to inflammation or this disease and pain.
Could you have like an STI with this symptom and not realize it and need to go get tested?
Yeah, absolutely. Absolutely. And other STIs cause pain as well, such as HPV or herpes.
Okay.
HPV is extremely common, actually. And so it's good to get checked out just in case to see if that might be leading to some pain or to help try to prevent it from leading to any pelvic pain.
Interesting. I hadn't heard that related to HPV. Do we know what exactly it is about that particular virus that might cause pelvic pain?
Not sure.
Just that
I'm
there's
not
an
sure.
association?
Yeah.
Yeah. We should probably say we're not medical doctors, right? We are kind of giving this overview of what we have learned, right? Just some basic knowledge around what are the different diagnoses that might be related.
Yeah.
But we kind of come in a little bit later, right, to help people with coping with this particular issue.
Right. This is just to provide some hope that you might have an answer to your pelvic pain, because there are so many different areas that could be causing this that like there is something. It's not all in your head. There is probably something related. We just need to get you the right care and help you learn how to talk to your doctor about this so that you can get the diagnosis and the treatment plan and then recovery.
Exactly. And how harmful is it to just hold on to the belief it's all in my head? And of course it's not your fault if you've had that belief, because it's just a cultural belief. It's what's kind of promoted. But then you don't end up getting the help that you really need if you just assume, well, it's all on me to fix this.
Right, exactly. So a few more. Other infections like yeast infections or bacterial vaginosis, these are things that might be experiencing might cause you to experience pain because of itching or burning, that kind of thing. And another thing is a lot of people with pelvic pain, if they're experiencing these symptoms, they assume it's a yeast infection, and oftentimes they're wrong. So try not to like treat yourself. Go get it checked out to make sure it's a yeast infection and not something else. So another thing, nerve issues is a big one. We've got two main nerves going to the pelvic region, and there's a lot of things that can actually affect nerves, that can irritate them, that could damage them. Things such as structural issues with your hips or your spine, trauma such as falling really hard on your pelvic bone, your tailbone. Thank you. Yeah, like snowboarding or just slipping and falling.
That's a very specific example. If you snowboard.
I've known people to have serious damage to their tailbone through things like snowboarding.
Wow.
So different sports, or just if you're accident prone, you could have damage to this nerve that could be creating issues for you. Childbirth can irritate or damage these nerves, and so that can cause pain. And then also there are people that can have hypersensitive or an excess of nerve endings. Specifically, I believe it's in the vestibule of the vagina, but it's really interesting. Some people are born with that, an overproduction of nerves, and they know that because their belly button is also extremely sensitive to pain. So if you're someone where your belly button is extremely sensitive to pain, and you're having...
This sounds like something really interesting. If your belly button is sensitive to pain, then you might also have an increase in nerves in your vestibule.
In your vestibule of your vagina. Yep, because it comes from like the same like fetal tissue, essentially.
So interesting.
So
everybody poke your belly button and
and see the response.
Yeah. Wow.
Yeah. So that might just be an indicator for you. So there is such a thing as having too many nerve endings.
Okay.
That's really interesting. Okay, next one, smegma. So there is something to be said for oils or dead skin cells creating a buildup, which can cause clitoral adhesions. So different parts of the clitoris adhesions to a cell, and causes pain because it's rubbing against what you would almost like sandy.
Oh.
So that does not feel good.
Yeah. Oh, ouch.
Yeah. So that might be something going on if you're experiencing like clitoral pain.
Clitoral pain, okay.
And then allergies. Believe it or not, some people can be allergic to their partner's semen, or they might be allergic to things that they're coming into contact with that's causing irritation.
Something else to be mindful of. So allergies, it could be allergies to, did you just say your partner's semen? And I just I just blocked that out. Okay. I blanked out for a minute. Yeah, partner's semen. It could be a product you're using, something on a sex toy, a type of lubrication. Something you need to be careful of as well, performing oral. If your partner has eaten something or drank something that might be irritating or an allergen for you, like you need to be really mindful of that. That can cause pain and irritation as well, and inflammation, I would think.
Great point. Great point. So hopefully with this overview, you have more hope. You have hope that there's an answer.